Serology is the scientific study of blood, serum and other bodily fluids, with a primary focus on the immune system's response to pathogens or foreign substances. It involves the identification and quantification of antibodies, antigens and other immunological markers, providing vital insights into infections, immunity and autoimmune conditions. Serological testing is a cornerstone in fields such as immunology, epidemiology, transfusion medicine, and clinical diagnostics.
What is serum?
Blood is composed of plasma, red blood cells, white blood cells, and platelets. Serum is the liquid portion of blood that remains after clotting has removed the cells and clotting factors. It contains antibodies, immunoglobulins, produced by B cells in response to antigens, hormones, enzymes and electrolytes, indicators of various physiological and pathological conditions. Serology harnesses the information contained in serum to diagnose and monitor diseases.
Principles of serology.
Serology revolves around the interaction between antigens, foreign substances that trigger immune responses, and antibodies, proteins that recognize and neutralize antigens. These interactions can be measured using various laboratory techniques to detect antibodies in the blood as markers of past or present infections, antigens to identify active infections or specific pathogens.
Techniques in serology.
Modern serological testing employs various methods to detect and measure immune components. Key techniques include enzyme-linked immunosorbent assay, ELISA, detects and quantifies antibodies or antigens using enzyme-linked reactions that produce a measurable color change, commonly used for HIV, hepatitis, and COVID-19 testing. Agglutination tests involve the clumping of particles, such as latex beads coated with antigens or antibodies, used for blood typing, rheumatoid factor detection, and bacterial infections. Western blot combines gel electrophoresis and immunoblotting to detect specific proteins, e.g., antibodies to HIV. High specificity but labor-intensive. Rapid diagnostic tests, RDTs, provide quick results using lateral flow assays or immunochromatography, widely used in point-of-care settings for diseases like malaria and dengue. Radioimmunoassay, RIA, measures antigens or antibodies using radioactive isotopes, highly sensitive but less commonly used due to safety concerns. Complement fixation tests detects antibody-antigen complexes by observing the activity of the complement system, historically used for syphilis diagnosis.
Applications of serology.
Serology is a versatile tool with applications across various disciplines: infectious disease, diagnosis, detecting antibodies against pathogens like viruses, bacteria, fungi and parasites. Example, serological tests for HIV, syphilis and COVID-19. Immunity assessment, determining immunity levels following vaccination or previous infection. Example, checking immunity to measles, mumps and rubella, MMR. Blood typing and transfusion medicine, identifying blood group antigens, ABO and RH, to ensure compatibility for transfusions. Autoimmune disease diagnosis, detecting autoantibodies such as anti-nuclear antibodies, ANA, in lupus or rheumatoid factor, RF, in rheumatoid arthritis. Epidemiological studies, monitoring disease prevalence in populations through serosurveys. Example, measuring seroprevalence of COVID-19 antibodies to track pandemic spread. Forensic science, analyzing blood samples to identify individuals or determine exposure to toxins or pathogens.
Advantages of serological testing.
Non-invasive, requires only a blood sample for analysis. Specificity, can detect specific antibodies or antigens for precise diagnosis. Versatility, applicable to a wide range of diseases and conditions. Immunity assessment, useful for evaluating vaccine efficacy and immune status.
Limitations of serological testing.
Timing sensitivity. Antibodies may take days to weeks to appear after infection, potentially delaying diagnosis. Cross-reactivity. Some antibodies may react with non-specific antigens, leading to false positives. Quantification challenges. Antibody levels do not always correlate with immunity. Specialized equipment. Advanced techniques require trained personnel and laboratory facilities.
Advances in serology.
With advances in technology, serology is becoming more sophisticated and accessible. High-throughput testing. Automation has enabled large-scale serological screening. Point-of-care tests. Portable devices allow rapid testing in remote or resource-limited areas. Molecular serology combines serological techniques with molecular biology for enhanced sensitivity and specificity. Multiplex assays detect multiple antibodies or antigens in a single test, saving time and resources. Serology is an essential branch of immunology and diagnostics that has significantly advanced our understanding of disease processes and immune responses. Its ability to detect and measure immune markers has made it a critical tool in diagnosing infections, assessing immunity, and guiding public health interventions. As technology evolves, serological methods continue to play a pivotal role in combating global health challenges and improving patient care.